Hi, I'm Mara from MaraPanachi.com, and today I'm going to take you through a 3 to 5 minute easy flow for pregnancy, prenatal yoga for pregnant mamas who want to ease lower back pain. So a lot of my friends are pregnant these days, and one of them asked me for tips on how to ease some lower back pain. Lower back pain is something that can happen in the later stages of pregnancy when pressure from your baby starts to build up around the hip and pelvis area and put strain on our backs. It can also happen when we're on our feet for too much, too long, too often, and tight hamstrings, tightness in the hips, and all the shifts and changes that are happening. So try this and see if it helps. I hope it does. So what you want to do is come onto all fours. So spread your fingers wide, knees underneath the hips. And just allow your belly to become really heavy and maybe sway from side to side. So this alone should feel really good and like you're relieving, taking all the pressure off your back and your hips. Good, and take a few deep breaths. So breathing in through your nose into your back. And exhale any tension. Good, inhale, let your belly come forward as you look up. Dog stretch. Exhale, cat stretch. Curve your belly in. Round out your spine. Good, inhale. Let your belly become heavy, drawing towards your mat. Exhale. Good, one more time. Inhale, heavy belly, allowing it to fall towards the floor gently. And exhale, curve your spine in. Good, now you want to come back to table and draw your right ear and right hip toward each other. Good, inhale. And exhale to the other side. And come back to center, float over to one side. So stretching through the side. Good. And the side of your lower back. Flow to the other side. Come back to center. Take a deep breath in. Take one arm and interlace it underneath the other. And coming down onto your shoulder and your head. So just a gentle twist here. Keep your knees apart, nice and wide, making room for your belly. And this is a little twist that starts to release any pressure that's building up in the spine. Inhale, slowly come back forward to center. And exhale, interlace the other arm through and rest on your shoulder, upper arm, and head. Now try to let go as much as you can in your hip area. Good, take a deep breath in. Come back to center. And just come onto your knees, rest your hands on your hips, and do a couple of hip rotations. But sometimes just moving things a little makes room. Room in our pelvis for things to shift and redistribute some weight. Good, and go the other way. Right foot forward, rocking forward and back. Following your breath. It's a really great thing to do during labor as well, to encourage a baby to come into optimal position and to encourage your baby to come down through your pelvis. Good. And switch sides. Sometimes the pain is created with pressure on a certain nerve, and just by shifting things around in this area, hip and pelvis area, can relieve a lot of pain and tension. So you can do this every day. Good. Now come back onto your knees, reach your hands forward, and find a half downward dog or a puppy stretch. So knees wide apart, hands forward, shift your hips back over your heels. So inhale, reach through your fingers, be nice and long, and exhale, reach your tailbone toward the back of the room. So nice long spine. Good. Big breath in right here. And exhale all the air out. Good. Come up, have a seat, and slowly make your way onto your back. So come down onto your side. We won't be here for very long, but if being on your back is really uncomfortable, you can put a pillow to elevate your hips to take the pressure off if it doesn't feel good. So inhale, take your knees towards your chest, spread them nice and wide, make lots of room, and tuck them in towards your rib cage and to the sides. Okay, so this helps to stretch out your lower back. And you can bring this into a gentle rock. And start to feel a massage in your sacrum area. You can now reach down, grab the insides of your feet or your ankles, and find happy baby. Okay, so feet toward the ceiling. And again, you can rock from side to side. Shifting, breathing. Good. Now, from here, take your hands out into a T position and slowly bring one knee to the floor. If there's room and if it feels okay for you, allow the other knee to follow. But it's perfectly okay to leave the top leg on the floor with knee pointed up. So you can facilitate this gentle twist by pressing on the top leg and maybe looking in the opposite direction. Now you can extend your top leg at the knee so that straightening the leg is going to bring a nice deep stretch in the IT band all the way through your outer hip and connecting with your lower back. Good. Bend your top knee, slowly rock back to center, give yourself a nice little squeeze right here, and then over to the other side. So knees down first, maybe looking over the opposite direction. And then here you can choose to extend that top leg for a deep stretch in your IT band and through to your lower back. Okay, rock slowly back to center, over to one side, push into the floor and help yourself back up to a comfortable seated position. And that's it, a quick little lower back release and refresher. Namaste, pregnant mamas.